Right, good evening everybody. I'd like to officially now welcome you to our Digital Infoday Session. So this webinar is going to cover how to manage diet and exercise while living with myeloma. So we're going to be discussing some top tips as well as giving some advice on healthy lifestyle choices. Just to let you know, the webinar is being recorded and will be available to watch on our Facebook page and on our website soon after. So the structure of this evening's webinar is going to be a presentation from both of our speakers, and then we're going to have time for some questions at the end. If during the webinar you'd like to chat with each other, you can use the chat box, and if you have questions for the speaker, please use the Q&A box, and both of those are at the bottom of your Zoom screen. You can submit questions at any time during the event, and we'll try and get through as many of these as is possible in the time in the Q&A section. And many thanks to those who've already submitted some questions to us. As an organisation, we rely on the generosity and kindness of supporters, fundraising and donating. Myeloma UK receives no core government funding, so your support is vital, and we're truly thankful for all contributions as they allow us to continue working to help patients, their families and friends. So I'd now like to just introduce myself. My name's Monica Morris. I work at Myeloma UK on the healthcare professional programmes. I'm also a nurse by background, worked in myeloma for many years and worked as a clinical nurse specialist for many years too. Myeloma UK is patient focused, and we aim to empower, inform and support patients in everything that we do. So without further ado, I'd like to welcome this evening's guests. So we're very lucky to have two professionals with us to talk about these topics tonight. So I'd like to welcome Bilam Patel, who's a senior specialist haematology and oncology dietitian at Guy's and St Thomas's Hospital in London. And also welcome to Kath Malhotra, who's a lecturer, practitioner and rehabilitation operational lead, gosh, that's a bit of a mouthful, in physiotherapy at the Royal Marsden School, Chelsea and Royal Marsden Hospital. So thank you both very much for speaking to us this evening. We're really looking forward to your talk. We've had a lot of interest in this webinar. It's a very popular topic and something that, you know, we always get a lot of questions about diet and exercise. So we're really all looking forward to the information to come and the questions. So Bilam, I'll hand over to you first to start your presentation. Thanks, Bilam.
Thank you, Monica, and thank you for the introduction. Hi, everybody. Thanks for joining us today. So I'm going to take you through a little bit about diet, nutrition and myeloma. As Monica said, I'm one of the haematology dietitians at Guy's Hospital, and I've been working in this area for about 3 years, and in general cancer and nutrition for about 10. So what we're going to cover today. So this talk's going to cover why good nutrition is important, a balanced diet, some of the main food groups. We'll also go through some common areas around supplements and debunking some myths around diet, because there's a lot of information out there. So I hope I can give you some sort of accurate information and debunk some myths that you might have understood previously. Okay. So why is good nutrition important? So maintaining the body's store of nutrients is so important, and there's nutrients in the diet that we can't make ourselves without those foods. It's really important for us to maintain our body's store, but also maintain our weight, and in turn maintain our strength and energy, and prevent nutritional deficiencies, but also we can use nutrition to reverse any identified nutritional deficiencies as well. Nutrition is so important to help our immune system to function effectively, which is really important during the treatment of myeloma, and in turn maximize our quality of life. And we know that good nutrition also improves tolerance to cancer treatments and their related side effects. Okay, so what is a balanced diet? So we've got 5 main food groups, and eating the right amount of the right food is really what we call balance in the diet. We want to provide nutrients that you need to protect your health during your treatment. And there's a huge focus around enjoying your diet as well. So ensuring you have an adequate intake of protein, calories, and micronutrients, but also that you can get enjoyment out of your diet too. And you may be wanting to lose weight, maintain your weight, and gain your weight, but it's important to include foods from all the groups in your diet to ensure you get all of the essential nutrients. So just to create a bit of a visual around what a healthy balanced diet looks like, and some of you might have seen this before, this is the Eat Well plate, and this applies to everybody. And this is what we feel would give you a visual representation of a plate, but also of your overall diet of what is health and balance. So you can see it's got all the main food groups, which we're going to go through today. And it also gives you a proportional idea of how much of each of the groups you should include. There's also a bit about hydration on there as well. And not forgetting, in the bottom left, you've got your treats as well. So it's all about enjoying your food and having them in the right proportions. Okay, so let's start with fruit and vegetables. So they're a great source of vitamins, minerals, fiber, and phytochemicals. And there's a huge focus around choosing a variety of colours. So I always say to patients, opt for a rainbow. To ensure you get the diversity of the nutrients in the diet. You can choose from fresh, frozen, tinned, dried, or juice. There's no superior, and aim for at least 5 portions a day to get a good range of nutrients and all of that nutrition. So in terms of protein, bread, rice, pasta, and other starchy carbohydrates, as we know them to be, they're a great source of energy, fiber, calcium, iron, and B vitamins. It's always best to choose whole grain varieties. You'll get more fiber that way, and include at least 1 starchy food with each main meal. The reason why we focus on fiber is that these foods are more bulky. They help us to feel fuller for longer. And so we're less likely to overeat or eat too much. And fiber helps to keep our bowels healthy and prevent constipation. So the fiber found in foods such as oats, beans, and lentils may also help reduce the amount of cholesterol in the blood. So a really important food group. Dairy and alternatives, it's an important source of calcium for our bone health. It's also a really good source of protein, vitamin A and B12. And choosing low-fat options is great for when you're aiming to sort of slim down, lose some calories, or maintain your weight. But people will often choose full-fat options as well if aiming for weight gain, as it's a really valuable source of calories. Aiming for 3 portions a day is about right. Protein. So beans, pulses, fish, eggs, meat, and other sources of protein are really important for iron, for the growth and repairing of our cells. We try to aim for at least 2 portions of fish per week, including a portion of oily fish, and trying to avoid processed meat. So processed meat has been either smoked, cured, or had salt or chemical preservatives added, rather than just having been cooked or reformed. So most sausages and burgers would be classed as processed meats. It also includes bacon, salami, chorizo, corned beef, pepperoni, pastrami, hot dogs, and all types of ham. So we recommend eating very little, if any, of processed meats because there is strong evidence that it is a cause of other cancers like bowel cancer, and it can be high in fat and salt. So if you eat meat, it's best to choose unprocessed meat. Red meat is a good source of nutrients and can form part of a healthy, balanced diet, but we don't need to eat it every day. So aim to eat no more than about 3 portions a week, and have a good variety of sources of protein in your diet, just to aim for a range of nutrients again. So oils and spreads are high in calories, as we know, and can contribute to weight gain, but that's quite useful for some people if they're losing weight unintentionally and trying to stabilize their weight. The best advice is just to choose healthier, unsaturated fats where possible. So cooking with olive, rapeseed, sunflower, or vegetable oil. So now we're going to talk about some of the food groups or nutrients that we might have heard about that have a bit of a buzz about them, and we're not quite sure where we stand with them in terms of benefits. Curcumin, or you might have heard of turmeric. So curcumin is the active component found in turmeric, and it's suggested to have anti-inflammatory and antioxidant properties. So the research around this is mainly in labs and in mice, but it does suggest that it prevents myeloma cell growth and increased effectiveness of some drugs like thalidomide. It does induce myeloma cell death in these trials as well. We just need to remember about curcumin that it can limit resistance to some other chemotherapy like cyclophosphamide, and has antiplatelet properties, so might not be suitable for someone with platelets or taking blood thinning drugs. The overall message here is just to check with your dietitian or your pharmacist about whether it's safe to take it. And it's important to note that although this is a spice found in the common sort of Indian cooking most commonly, the therapeutic dose of curcumin, so the dose at which we see this effect in these types of trials, is considered to be around 8 to 10 grams per day. So an average 25-gram jar of turmeric contains about 0.75 grams of curcumin. So you'd basically have to eat 11 or 12 jars of turmeric per day to get the dose that we've seen used in these trials. So a huge amount and not typically used in cooking. Cannabinoids. There's a lot of press around this, a lot around on the internet about cannabinoids, and they're basically the active components found in cannabis. And we've seen that this binds to specific receptors on cancer cells, and we've seen some studies show that it promotes myeloma cell death and reduces cell viability without affecting the healthy cells. But again, we've not seen these in clinical trials in humans, and it's exhaustively in labs or in mice trials. So we really need to replicate these benefits in human trials to really be able to recommend that you do this. So thinking about some of the dietary supplements that are commonly used, you don't really need sort of vitamin supplements if you're following a healthy, varied, balanced diet and you don't have any digestive disorders which inhibit your absorption of those nutrients from food itself. So the idea is, if we think back to that eat well plate, if we're eating a diet that's diverse, balanced, quite colourful, and having it in the proportions demonstrated by that visual representation, you should be getting all of the essential nutrients, and you shouldn't really need any vitamin or mineral supplementation. I guess the only caveat to that is vitamin D. We've all been quite cooped up recently, and it's quite difficult to make vitamin D in this country. We can only make it in certain months of the year. So a healthcare professional might prescribe a supplement to correct a deficiency like vitamin D. Evidence suggests it's the compounds working together in the overall diet that offer the strongest benefit. So actually getting your nutrients from food itself is the best way to do it. So thinking a bit more specifically about myeloma treatment, such as Velcade, we know that flavonoids, which are naturally found components in things like red wine, tea, fruit, and vegetables, might inhibit Velcade. So these foods are an essential part of the diet, so it's important not to cut them out, but there are some suggestions that it could inhibit Velcade. So to have these foods in moderation in the recommended quantities and not in excess. Vitamin C, again, has been shown to interfere with Velcade and prevent it from working. So whilst we know eating vitamin C in the diet is not going to have a huge impact on the effectiveness of Velcade, having something like a supplement would be strongly discouraged. And then the compound EGCG is found in green tea and prevents the action of Velcade. And so we do ask you to avoid drinking green tea or taking green tea supplements when on this drug. Going on to some common myths that we often hear about, I'll probably talk about the role of sugar in cancer every day in my job. These are really good questions that patients do ask, and there's a lot of buzz around sugar as well. What we know is that sugar is found in lots of foods, naturally and artificially. And naturally, we find it in fruit, vegetables, and milk. And they're very simple sugars. So they're absorbed quite quickly, that means, and shouldn't make up more than 5% of our total energy. So to put that into real terms, that's about 7 sugar cubes a day. Now, all cells will use sugar for energy, or it's sometimes known as glucose. It's not just cancer cells that use it for energy, it's all of our cells, including our healthy cells. And cancer cells use glucose in a slightly different way. So we say that those cells have an altered glucose metabolism. So our bodies are able to make glucose from non-carbohydrate sources by breaking down muscle and fats. So the message there is, even when we sort of omit it from our diet, our bodies will find ways to create energy, to create glucose by breaking down muscle and fat stores. So does sugar feed cancer? Well, when the body's starved of carbohydrates, ketones are produced from the liver because we store fat in the liver. So we'll break that fat down and make ketones. So you may have heard of the ketogenic diet, which the idea is to have a diet that's high in fat, moderate in protein, and low in carbohydrate. There's lots of different definitions of the ketogenic diet, but that's the basic principles. So people mainly eat meat, fish, nuts, oils, and seeds. The idea being that ketones are metabolized by the cells and not by cancer cells. And so this induces a state of what we call ketosis. There's quite a lot of weak evidence to support this as a benefit for myeloma, for cancer. And so we don't recommend you do it, purely because the foods that you're then omitting carry other essential nutrients that you're then by default omitting in your diet, and that can create other problems. Another common myth is the alkali diets. So the theory is that cancer cells thrive in an acidic environment in the body. And so the idea is that you can change your diet to change the pH environment in your body. However, the pH of the blood is a really tightly regulated process, and any kind of fluctuations in the normal range can be life-threatening for any human. We also know that by changing the diet, there's no sort of proof that you can actually change the pH in your body. And so advocates of the diet do advise cutting out really important food groups to achieve this. And we've neither seen the outcomes nor would we recommend cutting out major food groups that offer other nutritional benefits. It's the cancer itself that creates that acidic environment. And so this is not something that we'd recommend at all. Okay, so to close, seeing a dietitian can be really beneficial in terms of if you're struggling with eating, and that might be happening whether you're on treatment or not on treatment. You might be having a low appetite, you might be having very specific treatment side effects, and what a dietitian would do is go through what those side effects are, what you as a person are like with your eating, your habits, the quality of your diet, and not just offer you advice about your struggles with eating, but also offer you advice about the nutritional completeness of your diet and how you can then meet the deficits. It can be really helpful for when you're trying to lose weight or gain weight in significant amounts, and if you're experiencing really prolonged side effects even after you finish treatment. So if you do have questions about your diet, just ask to be referred to the dietitian in your team. The way I work is I sit with the consultants in the haematology clinics, and although you may have not met the dietitian yet, you could ask to see a dietitian with your clinical nurse specialist and be referred, and then you'll get that one-to-one individually tailored advice. So that's everything from me today. I'm going to hand over to Kath, who's going to talk you through exercise and myeloma. Thank you.
Great. It's Monica here again. Just wanted to say thanks, Bilam. That was fantastic. So much information in there, which I know we're going to have lots of questions about at the end of the webinar. So I'd now like to hand over to Kath for your presentation. Thanks, Kath.
Thanks, Monica, and thank you to Myeloma UK for inviting me, and thanks, Bilam. Hard act to follow. So I'm going to talk about exercise and myeloma, and the intention is that this talk will cover the importance and benefits of physical activity and exercise, and also discuss, I suppose, what we mean by physical activity and exercise and what the different types are, and how to incorporate this into your lifestyle as well, which may be picked up with some of the Q&A. So next slide. So exercise versus physical activity. So some of you may pick up some of the images here that may be familiar of your school days, you know, those gym knickers or the joy of cross country, and that may have actually sort of left you with a negative feeling about exercise. But exercise is a planned, structured, repetitive activity with the purpose of improving health and fitness. And it's usually a higher intensity. We tend to get a little bit hot and sweaty. And some people love this, but we also know that many may not do. And that might be associated with that school experience, or that I'm not into exercise, I'm not sporty. But that doesn't mean that you can't partake in some form of physical activity, because physical activity, on the other hand, is any activity where you're moving and expending energy, such as walking, gardening, dancing, and it's often more enjoyable and easier to incorporate into your lifestyle than a structured exercise program, for example. And often incorporating it into your lifestyle involves small changes. And you'll see here the love activity, hate exercise, that this is from our Charter Society of Physiotherapy. My background is as a physio. And you can love activity and get fit even if you're someone that hates exercise. But if you love exercise, well, that's great too. So if we move to the next slide. So the benefits of being physically active, you will see here there are a number of benefits, and I'm obviously presenting this with the remit of thinking about people living with myeloma, but these are the benefits for all of us for being physically active. So, and it's recognising that in general, exercise is safe and has no side effects if you start it gradually, and also if you have concerns, that you seek some support or advice from your doctor or physio. And we'll explore that a little bit later as we go through. But the benefits here are numerous. And just thinking, I suppose, of the experience that people may have of living with a cancer diagnosis and the side effects of treatment itself, we know that being physically active can reduce fatigue, can significantly help to improve sleep. And I think understanding the impact of lack of sleep, how that can have an impact both on our activity levels, but also thinking about nutrition as well, is really valuable to think about how we look to enhance that. It can also help to improve our brain function. So, you know, often by being physically active, it can help you to feel more cognitively sharp. It just gives you that little bit more of an edge and gives you back some of the energy, and can significantly help upon managing mood and reducing activity. And we know through experience and through the research that this is an area that's really important for people living with cancer, is to address sort of emotional well-being alongside physical well-being as well. And then thinking about you know, the issues that are very common within the people living with myeloma, things around our bone health. So improving bone strength, bone health, making us stronger by sort of looking at muscle strengthening, and also improving our heart function, our cardiovascular abilities, and reducing the risk of some other comorbidities that are very common, including the risk of diabetes, stroke, and heart disease. So it is, as that sort of image shows, a little bit of a magic pill, and has become quite prominent, I think, in discussion around healthcare. Okay. So when can it help to exercise? And I suppose I've pulled up these points really, being mindful of what we know for people living with myeloma, and that the majority of people will be experiencing bone pain or disease, obviously, within their bone. So it can help to be physically active to actually manage and alleviate this pain, in conjunction with effective pain relief and also the use of bisphosphonates. And exercise helps with our bone health, particularly weight-bearing type activities, and strengthening our muscles will also help to support the bone too. And this links very much with the evidence that we know for people living with bone metastases and people who have or are experiencing osteoporosis, which is something that we see very commonly in women or in our aging population as well. You know, it's something we all need to be mindful of. I also highlighted here around peripheral neuropathy that it can help to exercise with this as well. So there are always elements of caution, and we'll explore that as the slides go forward. But with peripheral neuropathy, there's a change, and it's often sort of a mild change that gradually builds up. And that might start with tingling in the fingers or an alteration in sort of the feeling in our feet. But that can build up over time and really impact upon balance and also create elements of pain. But being physically active and challenging your balance and incorporating that alongside effective pain relief and guidance from the pain teams or your doctors, again, is really beneficial. I've put hysteromyopathy because, again, thinking about the treatments that people undergo, steroids are often incorporated into people's treatment plans. And there are a number of fantastic benefits of steroids, but we also know that they can, over a longer period of time, cause muscles to become weaker. So again, if we're encouraging people to be as active as they can, it's a way of ensuring that the muscles are working and looking to maintain their strength as much as possible. It can also help to exercise. I mean, I said this from the beginning around sort of managing those side effects of treatment, but coping with treatment and being mindful that certainly sort of during the experience of living with myeloma, there may be peaks or troughs in treatment plans. You may be on high-dose chemotherapy, you may be undergoing a transplant, you may be on some maintenance therapy as well. And exercise is important throughout that whole time, and certainly is becoming more prominent, I think, in the research and the conversation, where you'll hear maybe a terminology such as prehabilitation, where we're looking to really enhance people's physical activity, their nutrition, and their emotional well-being in support and preparation for treatment. So you may well come across this on a regular basis at various different phases of your treatment. So next slide. So stepping back, what type of activity should I be doing? Well, we've highlighted here, and these are the Department of Health physical activity guidelines. So a bit like Willem showed you the eating well plate, which all of us should be incorporating into our lifestyle. The type of activity that we should be doing is the same for everyone. And this is that we should be incorporating some cardiovascular activity up to 150 minutes of moderate intense activity, and I'll discuss intensity in a sec, with strengthening type exercises at least twice a week. And really the key message is that some is good, more is better. So this isn't to guilt trip people to think, oh my goodness, I've not been doing this, I really should be. This is the reality of what we should all be aiming towards, and 150 minutes could be 30 minutes five times a week. But it could actually be 10 minutes here and now that build up to the 150. But even if you only manage to do 30 minutes of physical activity in a week, you're still doing more than maybe you were doing beforehand. And that's really the important message, is that there's a health gain, health benefit to be gained. And the strengthening type exercise is something that's become a stronger message with the update of these guidelines, and I'll explain further. So have the next slide. So the health gain here, so this is my little bit of, please don't feel guilty if you're not. If you're doing more than 150 minutes, fantastic. But you'll see this is a dose response curve. So you see that sort of, it goes steep and then it kind of plateaus off. And you'll see that circle there from going from sedentary, where you're doing nothing, up to 100 minutes, is where you really see the greatest benefits. So the greatest gains are actually in those who go from doing nothing to doing something. And we know that even doing 2 minutes brisk walking has a physiological benefit. So, you know, incorporating little and often is better than not doing anything at all. And what did I mean by moderate? So it's moderate exercise or moderate intensity. This is where your heart rate and your breathing rate increase. And you may feel a bit hot and even break out in a sweat, but you're still able to hold a conversation. I often describe it with my patients as feeling pleasantly breathless. You might look at me as if to say, but you know, you don't want to feel breathless, but you want to feel like you've got a little bit of puff there, that you're working that little bit harder than you normally would do. So if you see the grading on the right hand side, where 0 is complete rest and 10 is very, very hard, this is referred to sometimes as a perceived exertion scale, where you're going from 0 to 10. And what we really want people to do is get to that between 4 and 5, so that they're pushing themselves and they feel that it's hard, and if they went a little bit harder, they'd really start to struggle a little bit more. So it's maybe challenging yourself to understand how your body feels, because this scale is pertinent to the individual person. It's not that everybody will experience the same. So what might seem like quite a gentle walk for me, for somebody else could be more challenging, and vice versa. Next slide. So some examples of moderate type cardiovascular activity are brisk walking. And when we talk about brisk walking, I often say if you can try and get a little bit of an arm swing in there, so that you're sort of just pushing yourself that little bit harder, you will feel more of a physiological benefit. Slightly different, maybe a slow meander. When you're out maybe walking the dog, sometimes, you know, they can slow you down as well as encourage you to be physically active. But even if you only do that slow meander, you're doing more than you potentially might not have done. I've put here cycling on the flat is a moderate intense exercise. I'm not very keen on cycling, and what I tend to find is that even when I get on a bike, something that again may feel quite easy for one person, for me is more challenging. So it's about understanding your own individual response. But another great exercise is walking up the stairs, and incorporating that on a regular basis is a really good cardiovascular workout. And being out in the garden, challenging yourself a little bit with lawn mowing, or even down the ground, but being quite sort of vigorous with weeding, in itself, you are creating more of a cardiovascular type activity. So strengthening, and this is where the guidelines have really increased. We've got a greater understanding of how important muscle strengthening is. And we should be trying to incorporate this at least twice a week into our lifestyle. And there are a number of sort of strengthening type exercises, but the encouragement is to try and use a little bit of weight or weightage. And you can use your own body weight with certain exercises, but you can use free weights. And I'm not sort of saying, right, you need to go off and buy loads of equipment here. You can actually use two filled bottles of water. You could use the tins from the cupboard, but something that you feel that you're lifting that's just making you work a little bit harder. You can get resistance bands, and your physiotherapist may provide you with these, but even activities like lifting the shopping or being out in the garden will be strengthening themselves, and anything is better than nothing. So incorporating a few into your lifestyle is better than doing nothing at all. And if you are sort of incorporating some of these exercises, and my top tip here is downloading the exercise for myeloma patients info sheet off Myeloma UK. But here, what you're looking to do is to incorporate activity with the major muscle groups. So thinking about your large muscles, your leg muscles, your upper body muscles, and aiming to do 8 to 12 repetitions. You'll see on the exercise sheet, it starts with 5. But you should start to feel tired around the last 2 reps. And if you're not feeling tired, then increase to 2 sets of the activity. And great exercises. I sort of smile to myself that physios, we tend to provide the same thing, whoever you see, but the greatest exercise I think in the world is the sit to stand, because it's the most simple exercise that you can do, but it's also the most practical. So standing up and sitting down is a great exercise in itself that you could do of an evening just sitting in front of the TV. Upper body strength, you could actually just place your hands on the wall and press into the wall, and you're using, again, your own body weight. And squats is, again, a great form of working those, your thigh muscles, but also your glutes. And they're really practical type exercises that are going to help with some of your normal activities of daily living. What I would say is try and keep those slow and controlled. We're looking at quantity rather than quality. Sorry, I've said it the wrong way around. Quality rather than quantity. It's really important that you think about doing the exercise well, and that you feel that you're maintaining a good posture and a good position. So the exercises for myeloma patients incorporate strengthening work, but also some flexibility and stretching, which themselves are really important. In addition, the other thing that's really important is to try and reduce the sedentary behaviour. Now, I'm mindful that we're here this afternoon, this evening, on a 1 hour seminar, webinar, sitting down, probably for an hour. And my challenge to you at the end of this is to make sure you get up and have a good move around, because we should be trying to reduce the amount of time that we're sitting. We know that there are a number of health benefits for doing this. So taking regular breaks from looking at our screens, looking to stand instead of sitting when you can. So for example, if you're taking a phone call, or even if you're watching TV of an evening, you can stand up when the adverts come on and move around a little bit and then sit back down. A lot of us these days have a number of like Fitbits or Apple Watches, or maybe, you know, on your smartphone, there might be something that just reminds you to change position. And it's just very, very useful for good cardiovascular circulation. Okay, and I've just seen it is really difficult, I think, when you are maybe working, that, you know, I think the last year during COVID has been more of a challenge in regard to suddenly being more sedentary and sitting down in front of our PCs. But building in something, whether it be your screensaver, is a great option of just alerting you and reminding you to get up and move. So my shout out again, and I think it's really important to think about this in the context that we know from the research, and this is the research specifically within cancer, that the Chief Medical Officer's guidance is safe for us all to be doing. And these are the physical activity guidance for adults and older adults. And you'll see it has the building strength, the minimising sedentary behaviour, but also looking to improve balance, which again is a very important activity to do alongside managing the side effects of myeloma treatment and the disease itself. So what adaptations should you be making? And there are a number of exercises that you can do safely. And what I would say is it's quite difficult running a seminar like this, because ultimately it comes down to the individual. And I think Bilam said that at the end of her presentation, is that what we want to do is to provide something that's tailored to the individual. It's very much the ethos of personalised care. So where possible, I would encourage you to seek advice from a physiotherapist. And there are more and more physiotherapists available within the services supporting people who are having their cancer treatments, who do have a greater understanding and awareness of the benefits of physical activity and exercise and how that can be tailored. We do recommend, though, that high impact activities such as running, squash and contact sports like rugby should be avoided, because the majority of people with myeloma do have bony involvement with their disease. Now, what I would say is, from an individual as a physiotherapist and the patients that I've interacted with and my colleagues have, is that if we do come across people that want to be able to run, or when we say run, it's more jogging or just an activity that they've always loved to do. And what we would try to do is work with them and support them with some really effective strengthening to see if we can get them back to some of those activities that they enjoy doing. But it's very much about encouraging an informed understanding of what the risks might be and how things can be adapted to support people to do that, so that they get to do what's important to them, what matters to them. Adaptations will also need to be made depending on where you're at with your treatment, because there may be an infection risk. If you may be on sort of high dose chemos or chemotherapy that has reduced your immune system and put you at risk of infection, avoiding, now that suddenly we can get back into the gyms and the swimming pools, but maybe avoiding those public places could be necessary at certain points in your treatment, or depending on how you're feeling. And what I would say, that even on the days that you don't feel you can exercise, so you're not maybe feeling at your best, or your energy levels aren't as good, still try to incorporate some type of activity, whether it just be that you challenge yourself to go up the stairs that extra time, or get out and have a short walk at the end of the day. It will make you feel better, and it's a great way of just ensuring that you keep what you've got. Okay, so the next slide is why some of those elements are important. Is that, you know, there is the risk of bone disease and the risk of pathological fractures with a number of our patients, and that's where having that discussion with your doctor, making use really of those scans and those reports that you have, that, you know, we have a better understanding of the individuals, looking at skeletal surveys, for example, is that how we can look to support people and tailor the programs that we provide. But we do know the balance of actually encouraging people to be active is really important to help support some of that bone disease and bone changes, because by being active actually encourages bones to grow and to redesign and remold themselves. So that's why we still encourage you to be as active as possible. And I've put this slide in really, so, you know, we can have these conversations, we can try and raise that motivation, but we do recognise we're all human. We all understand that, you know, there may be some limitations, there may be some barriers, there may be things that just, you know, it's working out for yourself and challenging yourself to think, what is it that's holding me back? What is it that maybe stops me doing it? And it's really important to just think about anything that you do, you need to start it gently and build up gradually. Don't suddenly think, you know, I think, you know, the last few months have been quite exciting with the amount of sport that's been available to watch, and it's quite inspiring. But really try and gradually increase your activity levels rather than going flat out right from the beginning. And this will help to sort of manage a lot of those symptoms, including fatigue. Try and build physical activity into your daily routine as well, so that it becomes part and parcel of what you do, and sort of more habit forming really, to incorporate it. So like I said, taking the stairs, if you're, you know, you've got a hospital appointment, maybe don't jump in the lift to go up that one floor, maybe take the stairs, you know, and take your time doing it, but you'll have achieved something and been quite active on a day that hospital appointments can be quite sedentary themselves when you're waiting for clinic appointments. And try and incorporate those small changes. So I've put here the one brisk 10-minute walk a day has health benefits, but as I said, even 2 minutes has a physiological benefit. Okay. These precautions I've taken for you for consistency, but they are listed in the information that's provided on the Myeloma UK website and in the info sheets. And really, it just highlights the importance here that if you are going to undertake exercise that you've never done before, seek some support and advice from your doctor or from your clinical nurse specialist, and be asked to be referred to a physiotherapist. Often, if you don't ask, they may not necessarily think to do it as routinely, although we're very much pushing that this becomes a standard part of treatment. I've highlighted here about the public gyms and swimming pools. There's also a little bit of guidance here about minimising activities that might increase the risk of falling or jarring, such as walking on uneven ground. But again, with the peripheral neuropathy, if you know that that's something that's happening, doing some work within your safe home environment that challenges your balance and builds your muscles, you should then find when you're out walking, it puts you at reduces the risk of falling. Or you might want to link up with some of the groups like Nordic Walking, where they're using the Nordic poles can actually help to support your balance if you're out walking outside. Some of this is very sort of what I would say sensible approaches, but making sure you've got a safe space, supportive footwear, and comfortable clothing. But the important things to also think about is that if you start to feel breathless, but it's a change in your breathing that's not settling, then stop, rest, and see if it settles down. And the same if you develop any new or increasing pain that's new or unusual, you've not experienced this before, then stop. See if it settles. If it's not settling, then I very much advise you to contact your doctor or nurse and let them know that this has happened. But sometimes when you're doing a new form of physical activity, you will naturally feel general aches and pains. Your body's reacting to that. But the common place is to see if it settles down. So build up gradually, little and often is the best approach to exercise, and pace yourself and listen to your body. So there are some resources, and you'll see that there's the exercise for myeloma patient sheet. There's also some guidance from Macmillan on the Move More guidance. And there are some great schemes out there. Often to be physically active, there's something about having a buddy or having that support mechanism so that you're not doing it on your own. Or finding an activity that you love. So we've put here about the National Garden Scheme, getting out and working with teams who will support you as well is really beneficial, and seeing what's available in your local area. And definitely a number of these groups are beginning to open up more and more now. So I think I've put everything there. And I suppose my other shout out is to Park Run. So you do not have to run Park Run, but this is a regular initiative on a Saturday morning. It's free. It's got a real community feel to it. People are really supportive. And certainly you can look in your local area to see if there's a new initiative called the 5K Your Way, which is specifically targeted for the last Saturday of every calendar month for people who are living with cancer. And that's people themselves, their families, their friends, and also healthcare professionals. And it's an opportunity to run, jog, walk, volunteer or cheer within the local park run schemes as well. And I think, yeah, so in summary, physical activity can be safely completed both before, during and after treatment. It provides short and long-term benefits and can be easily incorporated into daily life. Thank you.
Lovely. Thank you so much, Kath. That was amazing. Both presentations full of so much. I know we could have a webinar on each of these topics, but we've got lots of questions, so we'll get through as many of those as we can. So first question is for you, Balam. And this question comes from Colin. Colin would like to know if there's any foods to avoid in general when on chemotherapy and on treatment or after a stem cell transplant. And we've also got another question about stem cell transplant, so I think you might be able to cover this as well. We've also had a question to ask what a clean, somebody's just had a stem cell transplant and they've been told to have a clean diet. So what does that mean? So it's foods to avoid and a little bit about what a clean diet is.
Thanks. Yeah, so when you mentioned foods to avoid, the thing that did pop to mind is the old terminology, really, clean diet. So the main thing to be aware about is safer eating during neutropenia, which is, in terms of food to avoid, it's basically after chemotherapy and stem cell transplants, patients are at greater risk of infection from bacteria or fungus in food, and waterborne infection as well. And it's because the white blood cells, or the neutrophils, that would usually fight sort of food poisoning bacteria, are at quite a low level. And this is called neutropenia. So the gut lining, which is usually our barrier between bacteria and the bloodstream, it becomes damaged by the treatment. And so it makes it easier for bacteria to cross that barrier into the bloodstream and create infections. So the neutropenic diet, or the clean diet, is quite old terminology. We're moving towards saying sort of safer eating during neutropenia. And the reason is that sorts of the evidence is quite a controversial area in haematology units, and the evidence for dietary restriction during this therapy is quite limited, and some institutions have actually removed all restrictions on diet during treatment, and they haven't seen any increases in infection rates. So there's a bit of controversy around recommending it, but what we continue to recommend is around food safety. So the main points are around food preparation and safety in cooking of foods as well. And there's some advice on what foods to avoid and alternatives to, which is quite in depth, and we probably don't have time to go into every food group, but the main points around food safety are washing your hands before cooking and food prep, protecting cuts and wounds before handling food, keeping raw and cooked meats separate when being stored, raw meats being stored at the bottom of the fridge to prevent contamination, using different chopping boards for fruit and vegetables versus cooked and raw meats, cleaning all surfaces appropriately before and after cooking, being really watchful of sell-by and use-by dates, covering your food, heating food up properly if you're reheating food, defrosting food in the fridge and not at room temperature, and ensuring all reheated food is piping hot before eating. So all of that advice is what we should all be doing, but it's that extra sort of vigilant approach in terms of food prep when you're immunosuppressed, so i.e. when you're on treatment or after stem cell transplant. And then some of the food groups do have certain foods which are more likely to incur foodborne infection, such as raw foods, sushi, raw seafood and things like that. But that's quite a bit more in depth, and we can certainly point you in the direction of some resources for that, but we probably don't have time to go into all the food groups today.
That's great, thank you. I guess it's important for patients and family members to sort of ask, really, like, because it's about understanding your own individual risk, isn't it? And sort of knowing when you need to start more precautions, and also when you need to stop, I guess, because sometimes it's like people carry on with a lot of precautions and actually they might not need to.
Absolutely. So this type of safer eating during neutropenia advice is for when you're neutropenic. So it's that period after chemotherapy, and it's a slightly more prolonged period after transplant. But nevertheless, it's a short-term implementation of sort of adjusting what you're eating just to avoid that foodborne infection. And as a dietitian in this area, we do recognise that between institutions, the advice is conflicting, and we're looking to standardise that with the British Dietetic Association as well.
That's great. That's really good to hear. So got a question now for Catherine. So this question is, I'm slowly recovering from recent treatment and want to gain my strength back, but I don't want to overdo it. What's some really gentle exercises that I could do?
So thanks, Monica. I think probably starting with the guidance on the exercise sheet from Myeloma UK is a great set of exercises to begin with, because they are achievable, practical, and you don't need any flash equipment to do them either, because I think that's often something that holds people back. And gradually progress your exercise. So it's about being sensible and reading your own energy levels, but certainly looking to incorporate regular walking as a form of cardiovascular exercise, and building up the distance. So what you've got to be practical of with walking is however far you go, you've got to get back. So thinking about how far you walk, whether it's a circuit around where you live locally, or sort of in the local park that you can get to without expending too much energy first, is a good way. And then incorporating the strengthening type work, I think, is really important, particularly if you haven't been doing much activity at all. Starting with those exercises and trying to do those maybe twice a week is a really good way to start, and to understand how your body feels. So if when you've done a workout, it's left you feeling incredibly fatigued, it is suggestive that maybe you've done a little bit too much. Now, that's not a bad thing, but it might mean that you need to give yourself a couple of days to recover before you then did that level of activity again. And it's about reading your own body's response in how you feel, and set yourself some realistic targets, so things that you want to aim for. So you have what we call our short-term goals and your long-term goals. So if you want to be able to get out and walk to the paper shop, but even that seems quite a hard challenge, because maybe it feels, you're a bit daunted and it's too far to get to, then maybe think about doing half that walk and going back home. But gradually, your intention would be that you build up to get to do that level of activity. And once you've achieved that, then think about, well, what's my next goal? What else can I do? So I hope that gives, I suppose, some top tips really of how to incorporate physical activity back into your lifestyle.
That's great. That's really helpful. Thank you. Thank you, Kath. Next question is for Bilam. So what diet advice can be given to those who've got allergies or intolerances to food? So this is, for example, people who have to follow a gluten-free diet, or those who are vegan, vegetarian, or maybe lactose intolerant. So, there may be a few different intolerances.
So this is quite a complex answer. If there's a number of different allergies, it certainly limits the diet hugely. And a dietitian can help you not just identify the areas of the diet which contain those allergens or foods to avoid, but also advise on how to eat around those limitations to ensure that you actually do get a nutritionally complete diet. So ensuring that you get 100% of the essential nutrients. And sometimes it's not always possible within the constraints of certain intolerances and allergies, but most of the time, especially as these allergens become more prevalent in the diet, we are making adaptations to some of our fortified foods so that we can meet our requirements through normal food and shop normally. So for example, if you were a celiac or had celiac disease, this is where your body has an autoimmune response to taking in gluten. And so this is where you would need to follow a gluten-free diet. And it is possible with an allergen like that to avoid gluten, but still have a nutritionally complete diet. But it's just important to note that celiacs need a higher intake of calcium, for example, because they're at greater risk of osteoporotic disease. And it's advice like that that's quite individually tailored that you would need from a healthcare professional, really. In contrast, it's really possible it's really difficult, for vegans, for example, to have a nutritionally complete diet when it comes to the vitamin B12, and a lot of vegans do need supplementation. So really, it requires a qualitative analysis of what you're eating, and advice on what to avoid the allergens, but also to ensure that what you're eating around it does meet your nutritional needs. So yeah, that question covers quite a few areas of allergens, which would be impossible to cover in one answer. But I would urge you, if you do have a number of intolerances, to speak with a dietitian who can sort of ensure you've got that supervision with what you're eating and make sure it's nutritionally complete.
That's great advice. Thanks, Bilam. Just to let you know, we've got lots and lots of questions, so we are going to go a little bit over, about 10 minutes over. So if those of you that are able to stay with us, we hope that you're able to. So next question is for both of you, actually. Next couple of questions, actually. We've been asked, I've gained a lot of weight during treatment and finding it difficult to lose weight with the current exercises I'm doing. What can I do to help lose more weight but stay nourished? Also, with that question, sorry, I'll find it in a minute. Yeah, we've also had another question from Jill about that. Is there anything that can be done to manage some of the hunger pains and cravings that you can get when you're on steroids? Yeah, over to you both. Bilal, maybe to you first.
Sure. Yeah, so managing your weight is really important to help prevent longer term health risk from being overweight or being obese, such as diabetes and heart disease. So I would revert people back to the healthy and balanced dietary recommendations, and also looking at specific nutrients more closely, like adequate fiber intake, which is really key to ensure you manage your food cravings, feel fuller for longer, so have that satiety there with what you're eating, and ensure adequate energy levels to get the most out of your exercise regimen. So the principles of healthy eating are fundamentally sort of the foundation that you want to build up from when you're struggling with weight gain, which we've discussed, and that would be your sort of starting point for this. And then it's important to sort of implement portion control, and also adequate hydration too. So we know, dehydration can really affect your energy levels. It can affect your bowel movements, and it can have just a real spiral effect on lots of other things. So ensuring you're adequately hydrated as well. And in reference to the hunger pains, yeah, this is a real issue for patients who are on steroids. And the way steroids work is they do increase appetite, and so all of your signals are there to eat. And so what I would usually advise in these situations is primarily going back to those healthy eating principles, but also looking at the types of carbohydrates that are being eaten, aiming for sort of lower glycemic index carbohydrates. So that basically means complex carbohydrates that release energy much more slowly and keep you having a feeling of fullness for longer. And so it's looking at the type of carbohydrates. Things like a jacket potato would have a low GI and release energy slowly. And there's dietary resources on the British Dietetic Association around those specific foods as well, that you can just do really gentle swaps with your carbohydrates to make sure you're choosing the right types of foods to keep you fuller for longer.
Thanks, Bilam. So from an exercise perspective, I shared with you the CMO, the Chief Medical Officer's guidelines, which is the 150 minutes of moderate intensity or 75 minutes of vigorous intensity. So that's, if you remember the scale of 0 to 10, and we want you to try and be at the 4 and 5. Actually, for any of us to lose weight, we need to be challenging ourselves potentially a little bit harder. So working at a higher intensity rate, or potentially doing more than 150 minutes. Now that can be quite challenging in itself, but again, if you haven't been even managing that amount, when you start to incorporate more physical activity into your lifestyle alongside a healthy diet, you should start to see some benefits with weight loss or weight management, because sometimes it's about managing the weight and toning up so that you've got stronger muscles. So you may find that when you weigh yourself, that your weight actually hasn't changed, but what may have changed is actually your shape. So sometimes measuring yourself and measuring, your weight, your waist and your hip size, actually you'll start to see some changes there in your body composition. I think I can see that I'm nodding alongside, but it's sometimes it's dispelling some of those myths, and the panic of putting yourself on the weighing scales is actually looking to see if your body shape's changing as well, because you're going to strengthen those muscles, which will have a real impact on how you're feeling.
Yeah, I completely agree, Kath. And, some of the risks that I mentioned earlier about diabetes and heart risk, they're all sort of centered around obesity, with central obesity. So where you hold your weight centrally around your abdomen, which is where all sort of your major organs are. So focusing on your waistline can be such a great qualitative parameter of your progress. So yeah, I really wholeheartedly agree.
Lovely. Thanks, both of you. We've got time for one more question, and I think just to sort of look at the converse side of that, Jane has a question. Jane asks, I've lost a lot of weight due to loss of appetite. What can you suggest I do to regain it? So, yeah, in a sort of fairly briefly, Bilam, over to you first, and then Kath, if you've got anything you'd like to add, please do.
Sure. So loss of appetite can be both driven by the myeloma itself, but also a side effect of the treatment. And when it's unintentional, it often occurs really quickly, and people usually notice depletion of muscle stores and changes to energy levels and subsequent weakness and fatigue. Diet's important in maintaining your weight and rebuilding that muscle. So the dietitian would usually assess the frequency and the quality of your diet and ask you exactly what you're eating and identify any major missing food groups. So we often start with just eating little and often. It can be a great starting point when you're struggling to eat the same quantities at your normal meal times. This means aiming to eat sort of a nourishing snack or small meal every 2 to 3 hours. And food fortification can also be quite helpful. So that's where you increase the nutritional quality of a meal. For example, a really simple one is just switching to full fat milk on your cereal instead of skimmed, in order to increase the number of calories and protein without necessarily feeling like you're eating much more than you were. So there's lots more we can advise, but dietitians tend to tailor the advice to your food preferences and your lifestyle. So definitely consider speaking with someone about this if those initial steps don't work.
Lovely, thank you. Kath, if you got anything to add, probably just a couple of very briefly.
I'd echo Bilam, and I suppose in a way with physical activity is still incorporating some level of activity, because that can actually help encourage an appetite and boost that appetite really. But it's going back to some of the simple exercises and incorporating some strengthening work so that you're not overexerting yourself, but you're managing within your energy levels, but still doing that little bit to get the health gains.
That's lovely. Thank you very much. Well, I think that's all we have time for the questions for today. So I just wanted to highlight some of the resources that have been mentioned, and I think you've seen popping up in the chat bar. So our website has information about diet and exercise. The link is there. There's a video about diet and nutrition, and also the info sheet on exercises for myeloma patients that Kath talked about in her presentation. So all of these things are available for you. And just to remind you, or let you know if you don't already know, about some of the other resources that we have at Myeloma UK for all sorts of other questions that you might have, or follow-on questions. So our Myeloma UK info line is available Monday to Friday, 9 till 5, staffed by the myeloma information specialists. We have a large range of information publications, which are you can look at on the website, or they can be posted out to you if you prefer a hard copy. Lots of videos available on the website, so do take a bit of time to have a look at those. Make sure you get up and have a little walk around between watching each video. Remember those words, not sitting for too long. Support groups. So support groups, there's a lot of different myeloma support groups around the country. Unfortunately, we know that it has been a bit more difficult for them to meet face to face of late. But a lot of them are meeting over Zoom or via phone calls and those sorts of things. And hopefully things will get up and running a bit more again soon. Also our info days and digital sessions. Obviously you're joining today's digital session, and we have obviously had face-to-face info days in the past, and we'll have further events, but just watch this space and keep an eye out for the further webinars to come. And we have an online discussion forum. So that's a good place if you want to ask questions of each other, or maybe you've got something useful you want to share. Particularly something might come up after today's session that you think might be useful to pass on. So yeah, please do have a look at all of these services that are there for you. So we've come to the end of our webinar today. Unfortunately, I think we could have carried on for 2 or 3 hours. I'm sure we had lots of questions. So I'd like to say thanks to our supporters. Myeloma UK is able to provide these free digital events like this one for patients and their families. So if you'd like to support the work of Myeloma UK, please visit our website. That's www.myeloma.org.uk/donate. Thank you. So finally, big thanks so much to both Bilam and to Kath for speaking and answering questions for us this evening. We're hugely grateful to you both for your expertise. Thank you also everyone who's joined for the webinar, and we hope that you found it helpful and informative. I know I have, and I've got a lot of food for thought, if you pardon the pun. If we didn't manage to answer your question, or it's thrown up some new questions for you, please do get in touch. You can do this via the info line, which I've mentioned. The number again is there on the slide. And we also have an email Ask the Nurse service. So please do use those if you've got questions. Keep an eye out on our social media and website for announcements of further digital info days. And once again, I'd like to thank all of you very much for joining us, and I hope you enjoy the rest of your evening. Thanks, and bye-bye.